All right, so today we're going to be doing a deep dive into a surgical case study.
Okay.
And this is a little bit different because we're putting you in the hot seat. You're the doctor on call,
Okay.
and a nurse is calling you up about a patient.
All right.
This is a 67-year-old male.
Mm-hmm.
It's day 10 post-op after a right hemicolectomy
Okay.
for carcinoma.
All right.
And he's reporting some pain and some concerning pink fluid seeping from his wound.
Right.
So what's your first move?
So before I rush to the bedside, I'd want to try and establish a clear picture of what's happening over the phone.
So you're going to play phone a friend with a nurse.
Exactly.
What are the essential questions that you want to ask?
So the first thing is to make sure that the nurse has already checked the ABCs.
Okay.
Airway, breathing, and circulation.
The best ones.
Absolutely. Always priority number one.
Right.
And then really zero in on the pain.
Okay.
So is it a constant pain? Does it worsen with movement or coughing?
Mm-hmm.
And, of course, get a really detailed description of that pink fluid. How much, the exact color, any odor.
Mm-hmm.
Because that pink fluid sign can actually be a real red flag for wound dehiscence, which is where the incision starts to reopen.
Okay, so pink fluid equals potential dehiscence.
Exactly.
Got it.
Yep.
Now, let's say you're on your way to see this patient, but you get called into another emergency, a cardiac arrest.
The joys of hospital life. You have to trust your team to manage that initial assessment
Right.
while you deal with the more life-threatening situation.
So triage is key.
Absolutely.
Okay, so 90 minutes later, you finally make it back to your post-op patient.
Right.
You find him distressed
Oh.
and with a visible bulge protruding from his abdomen.
Okay.
What's going through your mind right now?
So at this point, that bulge is a sure sign that things have escalated.
Gosh.
We're likely dealing with a full-blown wound dehiscence with a portion of the bowel actually pushing through that weakened incision.
So dehiscence confirmed.
Yes.
Now it's tempting to want to push that bowel back in,
Right?
but I have a feeling that's a bad idea.
You're absolutely right. That's a big no-no.
Okay.
Pushing it back in could cause further damage, and with the abdomen likely rigid, it would be incredibly painful and difficult.
So no heroic pushing.
No.
What's the correct approach?
So the first thing is to reassess those ABCs.
Okay.
Make sure he's stable,
Mm-hmm.
provide adequate pain relief, and also administer an antiemetic to prevent vomiting,
Okay.
which could worsen the situation.
Right.
Then cover that exposed bowel with sterile saline-soaked dressings to keep it moist and protected.
Okay.
And then it's really crucial to immediately contact the senior surgeon and prepare the patient for emergency surgery.
Now, while we're waiting for the cavalry to arrive, a.k.a. the surgical team,
Right.
let's use this time wisely and talk about what factors could have contributed to this wound dehiscence.
Yeah, absolutely.
Our sources break it down into preoperative, perioperative, and postoperative factors.
Exactly.
So starting with preoperative, anything that could impair wound healing.
Right.
So
Yeah.
think about conditions like anemia, diabetes,
Yep.
malnutrition, or even smoking.
Right.
Nicotine restricts blood flow, which hinders that oxygen and nutrient delivery,
Yeah.
which is crucial for healing.
Absolutely.
So even before the surgery begins, the patient's history and their lifestyle choices can really play a significant role.
Absolutely.
Okay, now let's move into the operating room.
Right.
Perioperative factors.
Yes.
Those occurring during the surgery itself can also be culprits.
Exactly.
So break down the OR dangers for us. What surgical aspects can increase the risk of dehiscence?
Surgical technique is paramount.
Okay.
If sutures are placed too close to the edge or poorly tied or cut too short, that wound is begging to reopen.
Yeah.
How the bowel is handled also matters.
Okay.
Rough handling leads to inflammation and swelling, which puts stress on those sutures.
Right.
And of course, any contamination during surgery, like a bowel leak,
Wow.
can drastically increase infection risk,
Oh, wow.
which further complicates healing.
So a delicate dance of precision and care within the abdomen.
Precisely.
And then we have the post-op period where a whole new set of challenges can arise.
Exactly.
So post-op, what can happen after the surgery that might lead to dehiscence?
So anything that strains that healing wound is a suspect.
Okay.
So coughing, especially in patients with chronic bronchitis, increases abdominal pressure and stresses that incision.
Right.
Obesity adds weight, further burdening that abdominal wall.
Okay.
And even constipation with straining during bowel movements can add pressure to the wound.
Oh, wow. It's fascinating how seemingly unrelated factors can influence something as specific as wound healing.
Absolutely.
Okay, so we've got the scene, we've got the problem, we've explored the potential causes. Now, I'm curious about the solution.
Right.
How do surgeons actually approach a wound dehiscence like this?
Yeah, so think of the surgeon as a meticulous architect,
Okay.
rebuilding a compromised structure.
Right.
They follow specific principles to ensure strength and minimize future complications. And one such guiding principle is Jenkins' rule.
Jenkins' rule sounds intriguing. Tell me more.
So it's essentially a roadmap for closing abdominal wounds.
Okay.
It dictates suture placement, spacing, even the length of material used,
Oh.
all aimed at maximizing strength and preventing dehiscence.
Right.
Imagine yourself as the surgeon meticulously stitching those layers together, following a blueprint for a rock-solid closure.
So it's not just sewing things back together, there's a science to it.
Absolutely.
Okay, so walk me through those steps.
So first, the patient goes under general anesthesia.
Okay.
Then the surgeon removes any damaged tissue, ensuring a clean slate for healing.
Right.
Using strong, non-absorbable sutures, they stitch together every layer of the abdominal wall, so the peritoneum,
Okay.
the tough rectus fascia, and the muscle.
And why the emphasis on non-absorbable sutures?
So we need those sutures to provide lasting support. They'll eventually become part of the body's own tissue,
Right.
but they'll continue to hold things together for a long time.
Okay, that makes sense. So you've got the deep layers secure. What about the skin?
So the skin gets closed as a separate layer,
Oh.
acting as a protective barrier.
Right.
But the real strength comes from those deep sutures.
Got it.
And when closing those deep layers, they use a technique called mass closure.
Mass closure. What makes that technique so special?
So think of it like building a sturdy wall.
Okay.
Each stitch grabs a big chunk of tissue, distributing the tension, making it less likely to tear apart.
Okay, that's a great analogy.
Right.
So we've covered a lot from the initial assessment to emergency response.
Yes.
The factors contributing to wound dehiscence and the surgical repair itself. It's clear that postoperative care is a delicate and complex process.
Absolutely.
And there's one more concept I want to introduce.
Okay.
Incisional hernias.
Right.
So imagine those deep layers weaken, maybe due to a previous dehiscence or improper healing.
Yep.
But the skin remains intact.
Okay.
So a portion of the intestine, or even fat, can bulge through that weak spot,
Right.
creating a visible lump under the skin. So it's like an internal bubble pushing outwards.
That's a good way to put it.
And this highlights the importance of proper wound closure and addressing those risk factors that we discussed.
Absolutely.
If those deep layers aren't strong,
Yeah.
it creates a vulnerability that can lead to issues down the road.
Exactly.
Now, we've covered a lot of ground,
Mm-hmm.
but there's one more crucial aspect we need to consider: the psychological impact on the patient.
Absolutely. It's easy to get caught up in the medical details
Right.
and forget the human experience.
So imagine going through this major surgery, thinking you're on the mend,
Right?
and suddenly facing this terrifying complication.
Yeah.
That's a lot to process.
It is. This patient likely feels anxious, fearful, even betrayed by their own body.
Right.
And that's where empathy and clear communication become paramount.
Yeah.
Taking the time to listen to their concerns, explain what's happening in a way they understand,
Right.
and reassure them that they're in good hands
Mm-hmm.
can make a world of difference.
It's a powerful reminder that being a doctor is about more than just textbook knowledge.
Exactly.
It's about connecting with the patient on a human level,
Yeah.
providing both medical care and emotional support.
It's about treating the whole person, not just the condition.
Very well said.
Absolutely. It's a crucial aspect of patient care.
Yeah.
It's often overlooked.
Now let's shift gears a bit
Okay.
and imagine this case was presented in an exam setting.
Oh.
So let's say you're a medical student and you're facing this scenario in an oral exam.
Right.
What key elements do you think the examiners would be looking for in your response?
So I think they would be expecting a systematic and prioritized approach,
Okay.
starting with those ABCs.
Right.
They want to hear you articulate those priorities, both in that initial phone call,
Mm-hmm.
but also when you get to the patient's bedside.
So even though this is a surgical case,
Yeah.
that foundation of your assessment really rests on those core medical principles.
Absolutely.
Okay, so they'd also want to see a thorough approach to history taking. So let's talk history. What are the critical pieces of information that you'd want to gather from the patient or the nursing staff?
So first, I'd want to gather the details about the surgery itself.
Okay.
So the type of procedure, the incision site,
Mm-hmm.
and any complications that occurred during the operation.
Got it.
Then focus on the post-operative course.
Okay.
So was there any fever, Any redness or swelling around the wound?
Mhm.
Did the amount or character of the drainage change?
Okay.
When did the pain start?
Right.
What makes it better or worse? And also, don't forget about those preoperative risk factors.
Right.
Ask about diabetes, smoking history,
Yeah.
and any previous issues with wound healing.
So you're essentially creating this comprehensive medical portrait of the patient,
Exactly.
including their past and the specific events that led up to this emergency.
Right, and this detailed history will help you formulate a differential diagnosis.
Okay.
So a list of possible explanations for the patient's symptoms.
History's done. Now it's on to the physical exam.
Right, the examiners would expect you to demonstrate a focused and thorough abdominal examination.
All right. So walk us through it. What are the key things that you'd be looking for?
So I would begin by inspecting the wound, noting any redness, swelling, tenderness, discharge, or gaping.
Mm-hmm.
Then gently palpate the abdomen, feeling for masses, tenderness, or guarding,
Okay.
which is involuntary muscle tightening.
Right.
And don't forget to auscultate the abdomen with your stethoscope,
Mm-hmm.
listening for bowel sounds.
So you're using all your senses to gather information about what's happening inside the abdomen.
Precisely based on the history and physical exam,
Right.
you can start to narrow down that differential diagnosis
Oh,
and
that-
consider which investigations are necessary.
Okay, let's talk investigations then.
Right.
What tests would you order to confirm the diagnosis and guide your management plan?
So in this case, the diagnosis of wound dehiscence is often clinical,
Okay.
based on the patient's symptoms and the physical exam findings.
Mm-hmm.
However, some investigations can be helpful. Blood work is essential.
All right.
A complete blood count can reveal infection or anemia,
Uh-huh.
both of which can impact healing.
All right.
And checking electrolytes and kidney function is important,
Yeah.
especially if the patient has been vomiting.
Okay, now what about imaging?
Right.
Would you order an X-ray or a CT scan?
So an abdominal X-ray can help rule out other causes of abdominal pain,
Okay.
like an obstruction.
Mm.
However, a CT scan offers much more detailed information
Okay.
about the extent of the wound dehiscence
Right.
and can also identify any additional complications,
Got it.
like an abscess.
So investigations are crucial for confirming your suspicions
Yes,
and getting that clear picture of the situation.
exactly. Once you've gathered all this information,
Right.
you can then move on to developing your management plan.
Okay, so let's talk management.
All right.
We've already touched on some immediate actions, like covering the exposed bowel and calling the surgeon.
Right.
But what other considerations are there?
So pain management is crucial.
Okay. Make sure the patient is comfortable while awaiting surgery.
Mm-hmm.
You'll likely start antibiotics to prevent infection.
Okay.
And if the patient's showing signs of shock,
Right.
like low blood pressure or a rapid heart rate,
Mm-hmm.
you need to address that aggressively with intravenous fluids
Okay.
and potentially medications to support their blood pressure.
So the focus is on stabilizing the patient
Yes,
and preparing them for surgery.
precisely. And the examiners would be expecting a clear and concise explanation of these management steps.
I imagine they'd also want to test your understanding of the surgical repair process itself.
Absolutely. They might ask you to describe the steps involved in closing the wound
Okay.
or discuss the different types of sutures that could be used.
So it's not enough to simply say, call the surgeon.
Right.
You need to demonstrate a deeper understanding of the surgical principles involved.
Exactly. And don't be surprised if they throw in a curveball,
Okay.
like asking you about Jenkins' rule or the mass closure technique. Right. So it sounds like they really want to make sure you have a solid grasp of the surgical aspects of this case.
That's right. It's important to review the relevant surgical literature
Okay.
and be prepared to discuss these concepts in detail.
So to recap, in an exam setting,
Mm-hmm.
you really need to showcase that systematic approach to assessment,
Mm-hmm.
a thorough understanding of the relevant history and physical exam findings,
Right.
a rationale for your investigations,
Yeah.
and a clear management plan
Yes.
that encompasses both medical and surgical considerations.
Exactly. Don't forget to emphasize the importance of communication and teamwork.
Right. This case really highlights that patient care is a collaborative effort
Absolutely.
involving multiple specialties working together to achieve the best possible outcome.
That's a key takeaway for any aspiring doctor.
Absolutely. It really is a team effort, and effective communication is vital. Now let's step back from this exam scenario
Okay.
and bring this back to our listener.
Right.
So we've dissected this case from multiple angles. The initial assessment, the emergency response, the factors that can lead to this complication, even the surgical repair itself.
Right.
But what does it all mean for someone who's not a doctor?
That's the crucial question. How do we make this knowledge accessible
Right.
and relevant to everyone, regardless of their medical background?
Exactly. So let's break it down.
Okay.
What are the key takeaways here for our listener?
I think first and foremost, this case highlights the incredible complexity of the human body.
Okay.
It underscores that surgical procedures involve a very delicate balance,
Right.
and it's not as simple as just cutting something out and stitching it back up.
Mm-hmm.
Multiple factors can influence the outcome.
Right. It's a complex interplay of variables.
Exactly.
Okay.
This case also emphasizes the importance of open communication between patients and their healthcare providers.
Right.
So if you're experiencing any unusual symptoms after surgery, don't hesitate to speak up.
Yeah, early detection and intervention can really make a difference.
Absolutely. It also serves as a reminder, I think, of the incredible skill and dedication of surgical teams.
Right.
We often take for granted the expertise and the precision that's required to perform these life-saving procedures.
That's a good point. We should appreciate the intricate work that they do.
Absolutely.
Okay.
Lastly, I think this case encourages us all to be more proactive about our own health.
Okay.
We talked about how pre-existing conditions like diabetes and smoking can impact wound healing.
Yeah.
So by managing these conditions effectively,
Mm-hmm.
we can potentially reduce our risk of complications if we ever need surgery.
So it's about taking ownership of our health and making choices that support our body's ability to heal and recover.
Exactly. A message that resonates far beyond the operating room.
This deep dive has been a fascinating journey,
Yeah, it has.
taking us from the initial moments of a surgical emergency all the way to these broader implications for patient care and personal health.
It's been a privilege to explore this case with you and share these insights with our listeners.
And as we close, we want to leave you with one final thought to ponder. Knowing what you know now, what steps would you take to advocate for your own health and well-being, especially if you were facing surgery? Until next time, stay curious, stay informed, and stay healthy.